My name is Felix Milan and I'm your host. And today I'm happy to have Kathy Laird from the Waterfall Community Health Center here as my first guest. Welcome, Kathy.
Thank you, Felix.
So tell me a little bit about the Waterfall Community Health Center. What is the Waterfall Community Health Center?
Well, the Waterfall Community Health Center is a nonprofit organization dedicated to providing health care to the underserved, uninsured folks in Coos County. And actually, we serve folks in surrounding counties as well, as Douglas and Curry.
I see. And your position with the health center is what?
I'm the executive director, chief executive officer.
I see. And how long have you been with the clinic?
I've been with Waterfall basically from the very beginning, and in the preconception period, I would guess you would call it, in the mid-90s.
I see. And how did the idea of having a community clinic for the underinsured and uninsured people, how did all that come about?
Well, I'm personally involved in healthcare. Originally, I'm a registered nurse as well, and in the mid-90s, Bay Area Hospital had done a needs assessment looking at, how were healthcare needs met in our community. And from that, it was identified that there's a huge number of folks not receiving health care, access to affordable health care. And so from that, there was also, early on, there was one nurse at Bay Area Hospital. Her name was Barbara Van Slyke currently. And she was, I would describe her as the forerunner of our movement, if you would call it that. And she's a nurse at Bay Area Hospital in the oncology department. And early on, she went out into our community and provided some volunteer care to folks like at the Mission in our Empire District. And from that, there was a lot of discussion that ensued, and a lot of wonderful folks, lay people, professionals in the healthcare system, physicians, nurses, came together and tried to look at what we might do to bring about something that could meet those needs.
I see. And how exactly does the Waterfall Community Health Center meet those needs and provide those services?
Well, we are a clinic like many other clinics in the area. We're a primary medical clinic, an ambulatory clinic. We don't provide emergency services, but we provide regular primary health care. So we provide services on a sliding fee scale based upon family size, family income, and we link those to the federal poverty guidelines. So actually we serve we serve anyone and everyone that wants to access our services. So we provide services sliding fee scale. We provide them through insurance, through Medicare, through Medicaid. We serve all age groups, from very young to the very old.
So primary care would be, for instance, common cold, flu, perhaps some ongoing medical issue rather than a specialized internist? Or
Yes, we don't provide specialty care. Mm-hmm. So we have an excellent referral system and working relationship with the specialists in our area, in the physician community. But we treat chronic diseases. Mm-hmm. Many folks make Waterfall Clinic actually is their medical home. And so they choose to come to the clinic and receive all of their medical care there, we do have to refer out for specialty care.
I see.
We don't do radiology or those kind of procedures there.
I like the concept of nobody's turned away, and that there's a medical home for people to feel comfortable at and in. Why did you personally want to become involved with the Waterfall Community Health Center? There's all these different options for nurses in the medical field today. What drew you to the clinic and becoming a vital part of that?
Well, you know, I don't think I ever really analyzed that. It just seemed like it was the right thing to do at that time, and it's what it's always been the right thing to do. Folks deserve affordable health care, and I believe that, you know, we all deserve to be healthy, and deserve to have access to that. I also truly believe in everyone has a responsibility to do, you know, okay, sorry.
It's okay.
There's rights and responsibilities. And I think that we do have the right for affordable access to health care, access to affordable health care. And along with that, I also have a responsibility to do what I can to live a healthy life.
Nice, very good. So a healthy life and access, it seems to lead right into my next question, is the mission statement of the Waterfall Community Health Center. I understand that it's gone through an evolution. Can you please explain a little bit about that?
Well, early on, when Waterfall first started, way back in 1998, that's when we became an official nonprofit, and we opened up our doors, and that was a wonderful community involvement. We, physicians and nurses and lay folks, gave up about an evening once every couple of weeks, and a physician in the Coos Bay area, Dr. Goodman, donated his office space. He had a practice downtown Coos Bay in the Hall building, so he donated that office space to us to be used after hours. And so early on, it was really about providing health care to folks who did not have any place else to go, who couldn't afford to go anywhere else. Only for people really with no insurance at that point in time. And so our mission was basically to provide access to affordable health care to the working poor and uninsured in Coos County. We've evolved over the years. We are now a community health center, and we've been one for about 1.5 years now. And we serve all folks, anyone who wants to receive services at our community health center. So our most recent, our mission statement has evolved, you know, over years, as you'll find probably in many organizations. Our most recent one, the board adopted mission statement, is to promote access to quality integrated health services that meet the needs of individuals with barriers to care on the Southern Oregon coast. So there's all kinds of barriers to care. It can be financial, it could be just numerous types of barriers. And so we want to open doors